Hello everyone. Welcome to Yashoda Hospital's online segment, the Health Talk session. Obesity is not just a mere cosmetic consideration, but it is a chronic medical condition leading to various other diseases. It has become one of the major concerns among the young population in India. It is a leading cause for heart diseases and diabetes. So we are here today to discuss about obesity, weight loss surgeries and various other diets. Do post your queries in our comment section and we'll get them answered shortly. I'm Dr. Lakshmi and let's welcome Dr. Kona Lakshmi Kumari, surgical gastroenterologist consultant from Yashoda Hospital, Somajiguda. Welcome, ma'am. So, ma'am, with the recent study done in Hyderabad, which says about 1/3 of our city's population is overweight, what do you have to say about this?
Yeah, it's very true, Lakshmi, that we are seeing more number of people who are now becoming the overweight and obese category. Basically, even I would say, let's go to a shopping mall to buy your clothes. I think it's easy to find sizes large and beyond rather than find a small or medium size. I think the clothing segment only first will reflect what is the people's body habitus, and we are getting more and more larger sizes indicates that there is a bigger demand for larger clothes, and that itself is an indicator that people are becoming obese. Even when you walk on the roads, you see the younger population, as you said, is becoming more obese. I think the concern that they are gaining weight has been lost, and even we see parents with obese children or overweight children not showing any concern that these kids are becoming more and more obese, and the eating habits have become very bad. We are seeing very high calorie foods easily available every nook and corner of Hyderabad, and that's what is causing all this problem of overweight and obesity increasing in numbers.
Do post your queries on this topic, obesity and weight loss surgeries, and we'll get them answered at the earliest. So taking the first question from our social media network, we've got Mr. Anand from Hyderabad. His question is, what is obesity and how do you quantify it?
Obesity is a measure of the excess weight we have on our body. The weight is according to our height. So our weight divided by the height should give you a number which is called the body mass index, and ideally it should be between 18 and 24. Or for a more simpler thing is, if you know your height in centimeters, you are 160 centimeters tall, so you minus 100 from that 160, so you get that weight number. So if you are 160 centimeters tall, you should be 60 kgs. So anything beyond that, if you are 5 kgs more than that, you are overweight. If you are 15 kgs more than that, you are becoming obese, and if you are 40 kgs more than that, you are morbidly obese. So that is how the simpler way we can expect the general population to learn what their ideal body weight should be and when they should start taking precautions.
So ma'am, talking about obesity, how do you think one should tackle this condition in our sedentary lifestyle?
See, first is, you mentioned sedentary lifestyle. So that sedentary lifestyle has to go. So you should try to be active throughout the day and walk more, take the stairs, and try to do your own personal work as far as possible, and cut down on eating high calorie foods throughout the day and throughout the week. So if these simple measures are done, then it prevents you from becoming obese. But if you are already starting to gain weight, it could be the child, it could be an adult, it could be a middle-aged person, but if you feel that you are gaining 1 kg, 2 kg or maybe 5 kgs in a year, then you should start doing some vigorous exercise. Otherwise, a regular moderate exercise, like even walking for half an hour daily and doing all your activities yourself and being physically active throughout the day rather than sitting and working on the system and using the remote and using the various gadgets to help you with your day-to-day activities. Physically doing your own work will prevent you from gaining weight.
Do post your queries on this topic, obesity and weight loss surgeries, and we'll get them answered by expert doctors here. So taking the next question, we've got Mrs. Pallavi from Secunderabad. She wants to know what are the various weight loss surgeries available and when should one consider this?
Basically, when we talk of surgically inducing a weight loss, the person's BMI should be 30 and above. That means they should be at least 30 to 40 kgs beyond their ideal body weight. And then if they are developing medical problems, like if they are becoming diabetic, if they are becoming hypertensive, or their joints have started to hurt, or they are developing snoring and becoming breathless if they are sleeping flat, what we call the obstructive sleep apnea. Now these are the indications that they should now put a sincere attempt to lose weight, and if they are failing the regular diet and exercise way of losing weight, then they should opt for bariatric surgery. Now coming to the next question, that what are the types of bariatric surgery? Bariatric surgery is a surgery on the stomach and small intestines, and the type of surgery depends upon the person's age, eating habits, and what are the medical problems they are having. And we decide the type of procedure. The procedures are divided into two types. One is the restrictive type of procedures and one is the restriction plus malabsorptive type of procedures. So restrictive type of procedures, we have the procedure which is commonly done called sleeve gastrectomy, and in the combination procedures where there is restriction and malabsorption, we have the bypasses. So there are different varieties of bypasses, but most commonly done are the Roux en Y gastric bypass and the mini gastric bypass. Now the advantage with a bypass is, suppose someone is obese and has a bad metabolic syndrome, that is in form of bad diabetes or hypertension and dyslipidemia, the bypasses give not only a good weight loss but also a absolute resolution of the metabolic syndrome.
So ma'am, talking about bariatric surgeries, should this be considered as the last resort or can it be considered at the initial stages itself?
Yeah, I would say that don't let your system deteriorate till the end. Means you are obese and you are suffering from lot of these problems like diabetes, cardiac diseases, hypertension, and then you wait till your heart goes absolutely bad or your lungs are absolutely deteriorated, you become wheelchair bound or bed bound and then opt for surgery. Your quality of life doesn't come back to normal. You may lose weight, your sugars may still come under control, but your heart which has gone bad or your lungs which are totally damaged or your joints which are totally gone will never recover. So earlier phases, when you are starting to become morbid obese, that is your BMI is going above 30, and then you feel that you are not able to shake off the weight with diet and exercise, then you should opt for bariatric surgery, because surgery will give you weight loss and improve in all the coexisting comorbid diseases and improve the quality of life and prevent your end organs from becoming end damaged.
Do post your queries on the topic obesity and weight loss surgeries and we'll get them answered shortly. So taking the next question, we've got Mr. Pawan from Warangal. His question is, what is the recovery time after surgery and when one can get back to normal activities?
99% of these surgeries are done the minimal access way or the laparoscopic technique, and the advantage with doing these surgeries, the minimal access technique, is the early return to work. So normally we require a 3 to 4 day stay in the hospital post procedure, and within 2 weeks from the day of your surgery you should be back to all your activities, including going to office and resuming your full day-to-day activities. So these surgeries don't require you to be bed bound unless your previous disease processes are so bad that you need to be monitored for some time. So don't let your organs deteriorate before opting for bariatric surgery.
So ma'am, what are the general side effects or complications that one faces during surgery?
I would say these surgeries are very safe, akin to getting a gallbladder surgery done or a hernia surgery done or a joint replacement done in an obese person for that body weight. So we could say the risks are less than 1%. Nevertheless, when we are talking of surgery, we have to mention that there is a less than 1% chance of developing bleeding during surgery or immediate post-op, or sometimes when you are joining the tissues. For some people, the healing of their body healing capacity may not be that great, so their healing may take a little more longer time. And obese people have an inherent problem of developing deep vein thrombosis, that is clots forming in their leg veins. So these are the small problems which can happen, but doesn't mean that we let them happen, but we take all precautions that even that 1% doesn't happen to you. But even if they happen, we take adequate precautions and adequate treatment so that the person recovers well.
So moving to the next question, we've got Mr. Naresh from Bangalore. His question is, will the weight be regained after surgery, and if so, can surgery be done for the second time?
Yes, usually once the procedure is done, the weight regain is a very rare problem, unless the person for whom the surgery is being done is not motivated himself to lose the weight, and they don't take the precautions of following a healthy lifestyle post surgery. Post surgery, we require the person to at least change their lifestyle. See, you have had a bad lifestyle, bad eating habits, and you have gained this weight and you are suffering because of the weight. Now surgery has been done and you have been given a better body or a good weight, and from there you should take precautions. See, our dietitians will work with you to make you understand what is healthy eating. Switch on to healthy eating, do a moderate exercise daily, which is a general recommendations for every one of us, and try to follow healthy eating habits. Then your weight would never come back. And if your weight comes back for any reason, like if you have got because so many centers are doing this type of surgeries, so if you got a restrictive procedure done and then you are so much obese that the restrictive procedure itself is not able to give you a weight loss, then we can always convert it to a malabsorptive procedure to give you additional weight loss. So a redo surgery can be done, but the indications for the redo surgery should be very scientific. It is not that we have done the surgery and you have not utilized the surgery fully and then you think that we can keep doing more and more surgeries to give you weight loss. No. So when the first surgery is done, that is the best time to lose weight and maintain your weight loss. And I would request to all those who are contemplating the surgery, once you get weight loss, please try to and learn to maintain your weight loss with healthy lifestyle.
So ma'am, talking about healthy eating, I'm sure most of us has followed some diet or the other at some point of a time. So would you recommend these fad diets or crash diets, and do you think they would be working on long-term basis?
Yeah, first one thing is, whenever you are doing any sort of this fancy diets, if daily you see someone advocating that do this, you lose weight, you understand that if you suddenly do anything means extreme, then what happens is your body protests against it, that we are trying to fight nature. So never do crash dieting, which is again scientifically none of the textbooks ever recommend that you suddenly go into not eating or trying to overeat some kind of food and avoiding certain kinds of food. No, because basically we have that system of having a certain degree of protein intake, certain degree of carbohydrate intake, and certain degree of fat intake also in form of good fats. So when we try to just topple that whole thing because of someone's thought process, we are actually fighting the system, and when the nature fights back, we know how bad it can be. So never try to disturb your body physiology by doing anything fad, and try to follow a healthy eating habit where you eat good quality protein, 50 to 60 grams daily, and then you eat a small gram of good quality fat which comes from the healthy dairy or the nuts, and then try to eat your carbohydrates as complex carbohydrates, not the refined carbohydrates like maida and sugar, but try to eat cereals and unpolished rice, whole wheat flour, and then I would say try to eat more fruits and fresh vegetables in your diet so that there is adequate fiber which will not allow a sudden surge in your sugars, what we call the low glycemic index foodstuffs. And this is what you should be eating. And then please exercise daily, at least go for a walk at least half an hour to 45 minutes daily, and that would make you achieve weight loss and help you maintain your body weight.
So moving to the next question, we've got Mr. Praveen from Nizamabad. His question is, high protein diet on long-term basis, is it safe or does it has any side effects?
Eating only protein or eating large quantity of protein, we are actually stressing our liver and kidneys, because that is where the protein gets metabolized, and through the kidneys the degradation products of the metabolized protein go out. So if you are loading lot of protein into your system beyond the necessity levels, your system cannot use it. Like if you eat 2 kgs of protein in any form, it could be meat, it could be dal, it could be anything, your body will not be able to utilize beyond the 50 to 60 grams which is necessary. So whatever excess, it could be carbohydrate, it could be fat, it could be protein, whatever you eat beyond the necessary required amount will always get converted to fat and stored. So eating excess protein will not make you muscular, eating excess protein will make you bulky in form of fat. So when you're eating protein, you should be also exercising. That is only when your muscles grow. If you're sedentary and you think that I'm eating protein and I'll become muscular, it is a wrong concept. And there are a lot of people who follow these keto diets and all, who end up with liver dysfunctions and kidney dysfunctions, which none of the people who are actually promoting these type of diets tell you, because they have no clue. And that this happens to the patient, because when the patient falls sick, he comes to the hospital. He doesn't go to the person who has been proposing these type of fat diets. So they are unscientific fat diets, and just mass following of a single person's thought process is not correct. Always follow what is medically recommended. Go to a trained dietitian or a certified nutritionist who can help you with the diet, rather than going to people who just with some imaginary thought process try to promote some types of diet. Because when 100 people follow this diet, at least 20 to 30 people will be falling sick because of the diet, and that never comes out into the open, and no one is aware what is happening to these type of people.
So ma'am, in this pandemic, was there any significant increase in patients opting for this weight loss surgeries because of lockdown and eating habits?
Yeah, there has been a sudden increase in the inquiries for bariatric surgery. One thing is, through the pandemic, what the people have learnt and we have also seen is that the obese people and those with metabolic syndrome have done badly with the disease. So we lost lot of people who were obese and then or obese and diabetic, obese and hypertensive, they succumbed to the disease. So that is where being fit and healthy became the prime concern. And it's not only that, now we have seen that throughout the pandemic there was this concept that we should eat a lot to become more immune resistant, and that is how people ended up eating lots of food, and they've gained almost 15-20 kgs in this past 2 years. And then we are seeing a lot of cardiac deaths now, because there is a sudden increase in the number of patients or people suddenly dying because of cardiac events. I would say that if you have become obese for whatever reason, and then you are not able to get your weight to the normal and you are falling in that high risk category, that is BMI beyond 30, better opt for surgery and then stay healthy, because this pandemic is going to stay for few years, and whoever is not fit are going to get affected by it, which we don't want. We want all of you to be healthy and fit and strong, so that our country depends upon our workforce, and if the workforce becomes sick, that is the younger population, then that is the economy is surely going to suffer. So I would request all of you, stay healthy, try to be fit. If you are not able to achieve that, please come, we will help you.
So ma'am, what are the general lifestyle modifications one should take up to prevent obesity and lead a healthy life?
Yeah, I would say that first learn to eat healthy. Try to include more fruits and vegetables in your diet. Cut down the visible fats. Cut down all the bakery stuff, the desserts, the ice creams, which are available plenty everywhere. And learn to eat complex carbohydrate. It's like your unpolished rice, whole wheat flour, and the different varieties of millets and cereals which are available. No need to go for the fad things like quinoa and all that, but whatever we have with grown in the state and in the country, try to eat that. And then try to eat good quality protein, not the red meat, the white meat. It could be unskinned chicken and fish as your protein source, and then you use the various pulses, beans, and try to get some good quality fat from nuts. A handful of nuts is what is recommended daily, and cut down the amount of beverage you are taking, cut down the amount of tea, coffee, and the soft drinks. I would say no fizzy drinks. So this is what should be there for a daily basis.
So this brings us to the end of this session. Hope all your queries on this topic were answered. We look forward for your active participation until the next week as well. Thank you and stay safe.